You've seen the images and the headlines, rashes that look like open blisters called monkeypox. Joining us from DC Health is State Epidemiologist Dr. Anil Mangla. Dr. Mangla, welcome back to Kappa Review. So the CDC reported multiple cases of monkeypox in the United States and possibly even in DC. How many confirmed and possible cases are being monitored in DC right now? And do you know if it's rapidly spreading from those current cases?
Hi, so thank you for having me on. So in DC, we have one confirmed case and one probable case that's effective from last night. These are independent cases, and we are now investigating to identify the sources so we can actually prevent any future spread.
And Dr. Mangla, what about the mental health and fear factor for people? Because after going through the pandemic, of course, nerves are frayed. So how do health departments get out information without putting a lot of people back into a panic mode?
Yeah, so what DC Health is doing currently is our communications department, as well as the other departments, aggressively providing education and outreach to the communities. Anytime there's an event, we have our posters there. We have education where people can come discuss a monkeypox or the difference of orthopox virus, and then we will share that information. To a more personal point of view is how can we avoid people from actually being scared about monkeypox is people should be aware of the symptoms, which are kind of flu-like initially, and then you start developing this rash. And the rash is a very fine macular rash, and then it goes through different phases of starting with lesions. Number two is we don't anticipate a major spread because of a few things that we have already started 2 weeks ago. Number one is we're working with our local physicians and the healthcare providers, so hospitals, ER centers, different outpatient clinics, and we have asked them to make sure if they find an unusual rash, they call the health department, and then we will guide them about the next steps. The reason behind this is we want to make sure we can quickly able to identify these cases, get them tested at the local public health lab, and if they are positive for orthopox virus, we want to start these investigations and close contacts immediately. The reason behind this is if we can identify these close contacts, we will get them into clinics and provide them the post-exposure prophylaxis, which is the vaccines that we already have in-house.
So, Dr. Mangla, we've been hearing the words monkeypox and orthopox. Can you explain what each are?
Yeah, so that's really straightforward. So, you know, in any kind of species, you have the so-called nomenclature tree. So monkeypox is part of a genus, which is orthopox. And orthopox is actually part of a family tree, which is known as poxvirus. So that's why the difference between orthopox virus and then monkeypox.
All right, a lot more to talk about with Dr. Mangla, including how contagious monkeypox is and how to best prevent it. We'll be right back.